All right, thank you, Mark. My name is Sarah Alger. I'm the director of the Russell Museum here at Mass General Hospital. Sorry. Welcome to everyone in the room. I must say a surprising number of people in the room considering the weather tonight. Thank you very much for your bravery, and to everyone who is on Zoom. A quick plug for our next two lectures before I introduce tonight's speaker. On February 10th, we are going to have the hospital's archivist, Lucy Ross, who we work with very closely. She'll be presenting The Fairy Godmother of Health Information Management, Grace Whiting Myers. And before you think to yourself, oh boy, health information management, Lucy really brings Myers's story to life. Myers was a librarian here in I believe, the 30s and the 40s. So I hope you are available for that. And then in March, exact date to be confirmed, we will have Dr. Robbie Goldstein, who is the current Public Health Commissioner for Massachusetts, talking about the history of public health here in Massachusetts. Just a housekeeping note for those on Zoom, use the Q&A function to ask questions. We'll be monitoring both the room and the Zoom for questions. And then with that, I'd like to introduce tonight's speaker, who is a repeat lecturer for us. Dr. Thomas Heyne is an attending physician in the Department of Medicine here at MGH. Welcome, Dr. Heyne. Thank you.
Sarah, is it safe to say if people start coming and they need more seats, they can bring up the chairs or something? Great. Well, thank you all for being here on this frigid day, and hopefully this will be a fun thing. Please just let me know if you're having a hard time hearing me. The visual is very important, so get in a spot where you can see the screen, because that's kind of the focus of this. It's all about art of observation, but on slides of paintings. And similarly on Zoom, if there's any issues, please let us know on the sooner side. So you can see my quotations there. No conflict of interest to report. And the images are mostly from the public domain. And just in case this talk tickles you a little bit, just to say that I'm not the only one who delves into this. And for myself, it's been one of a few of my little scholarly hobbies. But just to say, if you're in the department of, I don't know, whatever it is, neurology, and you're like, oh, that was kind of cool. You want to talk about art and neurology? The answer is yes, I probably could. I've got so many of these pieces I picked up over the years. So I've done sort of like the grand rounds or the equivalent thereof of all these different disease systems or specialties rather. So I'm focusing today on infectious disease, seemed appropriate sort of post-pandemic and whatever. And then I think on the call, maybe, do I need to, am I too tall or something? Dr. Katz, Joel Katz, one of our infectious disease colleagues over at Brigham and Women's, and he and I have been collaborating on some of the art and medicine stuff over there. So anyways, just a way of saying, if you like what you taste, there's more of a banquet. All right, so this is what we're going to do. This is sort of an unusual and hopefully fun and entertaining, and you guys get involved and kind of shout out your answers and get a little rowdy type of talk. So it's sort of like a case series in which we're going to talk about both published and unpublished. Unpublished, I've got these little blue stars, and if anybody's itching to publish something, you want to work with me to publish it, that's great. I'm pretty busy with 3 little kids, but I'm happy to delve into it with somebody. And then I've organized it by pathogens, right? This is how infectious disease doctors think. Viruses, fungi, parasites, bacteria. So that's how it's going to be structured. And then I'll start to give some clues and show the picture, and I'll say, well, what do you guys think? And that's when you can just shout out an answer. And then similarly, Sarah will be monitoring the Q&A. So it's the A too, you can give an A. So if you're out there, Dr. Katz or Dr. Ryan, and you think it's, whatever, leishmaniasis, then feel free to posit that. And if somebody gives me that feedback, I'll say, well done. Otherwise, you'll have to just feel warm in your heart that you did if I can't read those. And then in so doing, we're going to view, there's quite a few articles, believe it or not, written on this sort of niche field and some of the benefits of this exercise, which we'll go through this. But there's a lot of positive things about what we're about to do. But of course, there's some limitations of trying to diagnose something based on a canvas from 500 years ago. But I think hopefully we'll all walk away with a little deeper appreciation of the medical humanities, especially medical history and innovation, which is what this whole Russell Museum is about. All right, so here, let's jump right into it with the smallest pathogen, viruses. So this is Masaccio, one of the early and important members of the Renaissance. And this is the scene. So obviously this is mostly Renaissance, Baroque Europe, we'll be talking about. So lots of scenes from Christianity in the Bible and so forth. And here we have the scene from the Acts of the Apostles from the Bible, in which St. Peter's walking along, and people who were just had the shadow fall on them were healed, we're told. And here's one figure that looks beyond just sort of like a stereotypical sick guy or paralytic or so forth. There's pretty unique features that really suggest this is a real person. So first of all, you can look at his hands, which are kind of droopy, and his legs, which look like thin. So that's atrophy. And then atony means they're, again, kind of droopy, not very strong. But it seems like he's able to hold himself up. And in fact, he's on these little crutches there. And so it's almost like, pre-wheelchair, but this is how he's pulling himself along on the ground. So there's some chronicity to this, right? This just didn't happen last week. This has been going on for a while. Now we can think as neurologists. This first one is a little bit more complicated, but hopefully you'll bear with me here. So neurologists work through the nervous system, like where could the disease be? Well, the upper motor neurons, like cerebral palsy, sure we all have friends or family who have cerebral palsy. It's more spastic, right? Where your limbs are kind of brought in. He's not that, he's more flaccid. Myopathy is usually more proximal, like your shoulders, like you can't comb your hair anymore. So probably not a myopathy. So we're kind of narrowed down, quite likely a lower motor neuron disease in this particular area of the spinal column. Anyone want to hazard a guess what this might be? Just shout it out. Polio. Great. And there was the hint if you needed it. So there's a polio word of all the iron lungs, right? This was a big deal for a long time. So arguably, according to this person who wrote in the Lancet, this may be the earliest depiction we have of polio, the polio virus. So pretty fascinating, I think. All right, we're going to move to another. This is actually two portraits next to each other. Pretty remarkable. So this is a 16-year-old who is going to become Duke. And 7 days into his illness, this is what he looks like, this sort of like rash on his face. And then 2 days later, he looks like that, right? Ugh, that's like the right response. Interestingly, a few years earlier, he looked fine. So whatever it is, it's been more acute. And a year later, he looked fine. So whatever it is, it was an acute illness that looked bad and got better. Anyone hazard a guess what this would be? There you go, smallpox. So the way that we learn, hopefully we're still teaching medical students that smallpox is like a possibility if, Lord forbid, the way the world is going right now, but it's locked in a couple of labs in the world. And if we ever got smallpox, we didn't know what it looks like because it's such a big deal. But namely, unlike chicken pox, where you have lesions that are like some are more crusted, some are just starting, they're all the same. They all look the same, uniform. So that's how you know it's smallpox. This was like the most successful vaccine campaign ever. Based, for example, on part in this photo, the kid on the left, no vaccine. The kid on the right had a vaccine. So again, that's smallpox. By the way, vaccine, a little tidbit, that's from the Latin for cow, right? Like vaca in Spanish. So the idea is the first vaccine was for smallpox, this terrible disease that they got from cowpox. So that's how Jenner did it in England at the end of the 18th century and transformed kind of life for humanity forever afterwards. So we're going to now start kind of, as we're going along, we're going to review some of these like kind of take home points that doing this, which is fun. And I encourage you to go to museums and kind of look for disease. That's what I tend to do in my days off. But it tells you about these rare forgotten diseases, right? Because we're basically getting a snapshot of hundreds of years ago, which, by the way, looks a lot more like sub-Saharan Africa today, where they maybe don't have access to all these vaccines. And we hopefully appreciate the role of vaccines and sanitation. And you guys will go to Robbie Goldstein's talk in a couple months. He and I went to residency together. All right, so in the same vein, anyone want to hazard a guess what this is? That's a great idea. Measles. But again, there's sort of these uniform disease lesions all over the body. This isn't a trick. This is also smallpox. Okay, so there'll be some repeats. Okay. In particular, this is such a terrible disease, and in particular here in the quote New World, where there was no prior immunity. So I'm not going to read this whole thing, but basically we have accounts of just how terrible it was, and just populations wiped out and infrastructure destroyed. So yeah, smallpox, a terrible part of the whole European discovery story. All right, we're still in the quote new world, but obviously now more modern times. This one's a little tricky, so I need to get more hints. But this is an episode of blank disease in Buenos Aires. So you can see the mother. It's very tragic. Some of these are very tragic. And trying to take home like how good it is we don't have these anymore, or can generally vaccinate against them and so forth. But there's a father who's dead in the bed. There's a mother who's dead on the floor with the baby, like looking to breastfeed. Very tragic. And we know that Buenos Aires is relatively sort of tropical climate where there's lots of mosquitoes. And typically this starts as a flu-like illness. So you have like normal chap there on the left, and then the second pain, he's got more like flu-like illness, and then he's jaundice, and then like hemorrhagic fever, terribleness. Anyone want to guess what that is? Malaria is a great idea. Dengue is a very, very good idea. I missed that. H fever. I like all these different fevers. Yeah, hemorrhagic fever. So again, this is, I think all those would be reasonable. In particular, this is called an episode of yellow fever in Buenos Aires. So, I try to like make it yellow look yellow, but obviously there's a number of things that can cause jaundice and bleeding and so forth, hemorrhagic fevers like these. But also, like, if you're traveling to the endemic area, you can get a yellow fever vaccine, thank goodness. So there was a bad outbreak in 1871. There was a bad outbreak in the end of the 18th century in Philadelphia. I mean, this was a recurring theme when mosquitoes were kind of getting out of control in various areas. So yellow fever, there you go. And in fact, these two doctors died of yellow fever shortly, like not too long after this painting was done. All right, again, this is a bit of a stretch, but I'm in viruses and I wanted to at least include this virus. But this is Munch of the Scream fame. But this is self-portrait with blank disease, 1919. So this is like during the throes of his illness and like shortly thereafter. And you can see the year. That should be like the main clue. Flu, great. So tons of people died from the Spanish flu. And right now, too many people are dying from the flu. So we've had a pretty bad flu season so far. So this is self-portrait with Spanish flu. And of note, like less than 50% of people are vaccinating. I get, COVID vaccine, fine. COVID is like a cold for most people nowadays, but flu is like the flu. We can vaccinate. But anyways, so that's my little scream. Vaccinate, please. But anyways, so that's Spanish flu. All right, so that was viruses and artwork. We're going to keep moving. And fungi. I got a lot of slides. If you don't get to all of them, that's cool. So this is Murillo, is one of my favorite painters, but this is Thomas of Villanova giving alms. You can see the various sort of people who are poor using walking sticks and so forth. And if you zoom in on this child, you can see he's got alopecia or hair loss with these sort of circular crusts. Hazard guess what that is? Yeah, I heard it. Yeah, tinea, ringworm, great. So tinea capitis of the favus or honeycomb sort of subtype, because it kind of has this like honey, like crusty appearance. Basically, this is, I think, his way of taking home like, people really look like this. He really helped these poor people and they were really poor. So, just a way of saying it helps us interpret the artwork. We know what's going on there. Okay, Goya, before he kind of went crazy and showed paintings of people eating their children, had some very nice paintings before then. So this is some kids climbing a tree. And again, we've got, I'm not going to belabor this, but a similar thing where he's got tinea capitis on this child. Bucket list, I want to go see this piece. But, apparently it's this wonderful piece in a chapel attached to what was a hospital done in 1516 by Grunewald, Eisenheim altarpiece. And it's got like several layers to it, like some altar triptychs do. And this sort of frontal as you first come, very moving crucifixion. And if you really zoom in, you see that like this is different than many other crucifixions in that the way the body is kind of more like greenish. And there's sort of like all these sores all over. And then you can look at his hands and his feet just really like contorted. So you can guess if you like. There's no clear diagnosis that I've been aware of. I should also mention, so as you open the triptych is what this is called, like to show the next layer and show the next layer. It actually, and presumably he planned this, but as you kind of open it, you see it almost like amputates off the arm and the legs of Jesus. So some people thought maybe this is syphilis, because again, this is 1516. This is after syphilis came to from the New World to the Old World. So it was rampant, could be. And certainly in that hospital, I'm sure they're treating patients with syphilis. But but doesn't quite fit with all those things. So just put that in the back of your mind. So something that like causes greenish and like maybe you eventually need to amputate limbs and whatnot. So if you look at the other layers of this particular piece, in particular, we'll zoom in on this area, but so this is St. Anthony, and this is actually in like the hospital / monastery of St. Anthony. So one of these, like one of the very first like abbots, fathers of monasticism, very important, oftentimes pictured battling demons or doing healings and so forth. But next to him, there's this particular figure who just seems not doing well. Duress, probably moribund, what have you. And so I mean, look at that belly looks like. You know, maybe that's ascites, but you can also imagine maybe that's bowel ischemia, like dead bowel, right? Like not doing well. And he's got all these skin lesions all around. Again, this is the monastery of St. Anthony, also known as the Hospitaller Brothers. Anyone want to hazard a guess what I'm trying to get at with that first piece in this one? This is pretty tricky. Yeah, chickenpox won't kill you like that, or usually not. Yeah, gangrene, we're getting there. I don't know, Sarah, does anyone guess it out there? No. All right. So they treated what's called St. Anthony's fire, which is actually can be one of two things. It can be more of a cellulitis, but usually it's ergotism. Now, this isn't quite infectious disease because it's basically more of a toxicosis. So you eat this fungus that grows in like rye seeds and accidentally, and then you like nearly die because this the ergot, the sort of fungus that's there, has this vasoconstrictive quality. So basically vasoconstriction makes your arteries go like that, and then there's not enough blood, and then things get gangrenous and ischemic, whether that's your bowel or your arms and legs, and you have to lop off arms and legs. Interestingly, it can also affect the brain. So hallucinations are pretty common apparently. And so LSD or shrooms are sort of all related compounds to this particular mushroom. So, it's possible, for example, some people positive, like some of these, honestly, kind of like more tripped out paintings where there's, all these demons and stuff. Was that kind of referencing the hallucinations some of these patients would have? Anyways, pretty interesting, I think. We don't see that much, fortunately. Another piece that somebody wrote, published in the Pharaoh, so that's like the AOA journal. So here's several people here who are missing feet. Maybe there's some facial deformities or maybe a congenital deformity. I'm not going to belabor on this because I don't really feel particularly impressed with any of these. Maybe leprosy, maybe ergotism again, maybe polio, but they don't really explain why they're missing feet. So I don't really know. It seemed like someone was eager to publish something, but anyways, there's that piece. So we're going to understand the limitations of what we're doing. These are all hypotheses and something more or less far-fetched. Okay, moving now to parasites. So this is sort of the title piece for today. So this is Caravaggio's Sick Bacchus and a self-portrait. You can visit this in Rome in the Galleria Borghese. And so we know, quite a bit about Caravaggio and what was going on at this time. So this is after he moved from Milan to Rome to get more, Rome was like the place to be at the time. But not long after he got there, he became quite ill and he was hospitalized. All right, so let's look at the painting. So this is like after he was hospitalized, after he got better type of thing. Whatever it was probably pretty acute, right? If it had been going on for a while, he wouldn't have like this normal musculature. He'd be more wasted away. Also, we know in later portraits, he looked normal again. So a few years later, here he is. He has this theme of dressing up like Bacchus and drinking alcohol, I guess, but looked normal and looked nice and pink and whatever. So if you look at his face, and I can verify this because I had the pleasure of going to Rome not too long ago and seeing this, but you see a couple of things. First of all, he looks relatively yellow or jaundiced, whether it's his eyes or his skin, and then his conjunctivae, so the sort of pink part of our eyes, and his lips look pretty pale, which is sort of the poor man's way of saying anemia. So we got anemia plus jaundice after moving to Rome. So what do you guys think that is? Yeah, the title of the talk, malaria. Great. So people have talked about different things, Q fever, brucellosis, but common things being common, malaria seems pretty common, pretty likely. So malaria, this parasite, has been with us from ancient times, the sort of the nemesis of humanity, but brought by mosquitoes. It gets inside of our red blood cells, and then it bursts open the red blood cells. So that bursting, and just like a bruise, it looks yellow. So the idea is when the pigment that makes red blood cells red, breaks down, it looks yellow. So that's the jaundice. And then if you burst enough red blood cells, you get anemic, hence the anemia and the pallor. So I think that's a pretty reasonable hypothesis. Some people also talk about acute hepatitis, like Hep A, that can make you look pretty yellow and then you get better. So, I mean, who knows, but interesting. Well, because we're talking about Caravaggio, I wanted to take one step further. So this whole like fascinating field of paleo pathology, where people like go and run like PCRs on bones from the pharaohs or more recently or whatever, which is I think just so fascinating. But they did one of these studies of like, how did he die? So they think Caravaggio was a controversial figure and got involved in a lot of fights and had friends, he had enemies, etc. So we're not 100% sure exactly like if the tomb where he's buried is really him, but seems most likely it is. Anyway, so they did like DNA and PCR analysis of his skeleton, and sure enough, that's like full of Staph aureus. So staph, like as in staph infection, that is another nemesis to humanity. But so we know that he was wounded in a fight in Naples several days before. So certainly makes sense, like historically, that here he gets some wound, and several days later, the staph, there's pre-antibiotics, it goes over his body and dies from staph. So he survived malaria, but not staph. Interesting. All right, so now we're doing more of these learning objectives. We're learning more about these artists, and also I think looking very closely at these different paintings and the lips and so forth. We're helping to hone our own observational skills. So this is a quick tangent, sort of a plug for some of the work that the folks in the Arts Humanities Initiative, of which I'm one, but are doing, and whether here in the Harvard area or in others. But basically, they've done a number of studies that we have this current crisis, right? So all of our medical students and trainees, and frankly, even attendings, we spend all the time in front of screens, and we're pretty good at like interpreting like an MRI, but goodness gracious, we've lost these skills of like just doing a good physical exam and palpating a liver and a spleen, et cetera. So, or just looking and spending time with the patient and not having our back as we're, typing, et cetera. So question is like, everyone's trying to figure out how do you try to bring the student back to the bedside and really spend time and really hone your observational skills and hone the physical skills. Well, one thing that's been tried is to do basically these medical school courses or electives or so forth, in which you'd actually go together like with a team and look at artwork and talk about artwork. So for example, they did this study in Yale where they did basically an art observation course and actually like helped people's observation skills, which is pretty cool. So there's this whole thing called VTS, or visual thinking strategies, in which you can see a bunch of studies at different locations that have shown that this can help basically, again, improve people's observational skills. And then these sort of other added benefits, again, these aren't like obviously hard science studies, but, increase tolerance for ambiguity, since we don't really know what did the artist mean by this, et cetera. Increase in empathy, increase in mindfulness, increase in communication skills. I will say, but P.S., what we're doing right now isn't quite VTS. We're like trying to diagnose paintings with disease, which is like a fun little side thing. VTS is more like, let's go look at a painting pick your painting and let's just kind of talk about it, not necessarily specifically trying to diagnose things. So, but anyways, so this is fun stuff. It's, I think, a worthy goal that's been now reasonably well studied. Okay, tangent over, back to the paintings. So this is Maria Schiavelli, who, when she was only like 23, painted this painting in 1887. Again, not really specific, so I need to give more hints, but basically there's a farming community that lives outside Rome in an area called the Pontine Marshes, so the southeast of Rome. Anyone want to hazard a guess what this is? What the person in the bed is who looks a little bit, maybe jaundice, is suffering from? Again, I'm not trying to trick anyone. This is malaria. So again, how would you know that? I don't know, but I'm just putting all the malaria cases together. By the way, malaria is from the sort of Latin for bad air. So before they figured out it was mosquitoes, which is more modern discovery than you might think, they just thought it had something to do with the bad area around swamps and so forth. Somehow it gets you sick. So, the Romans like couldn't even sort of colonize this area because of just everyone dying from the malaria in the area. So it wasn't until basically modern times in the 20th century that they were able to, kind of get all the marsh drained and so forth. And then the Nazis like flooded it again, and we had to redrain it. So anyways, but the Pontine Marshes continue to be an issue. And again, you can see another just how devastating this disease is. And malaria, if you Google what kills more people than any disease worldwide, malaria is like, depending where you're at, either number one or number two. So it's just been this terrible plague. All right, we're now switching continents and centuries. I wanted to throw in stuff that isn't just sort of European centric, but I had the opportunity to go to a conference in ultrasound, tropical ultrasound in Peru, and I got to this awesome museum called the Museum Lorca, which is in Lima, and it's got hundreds of these really cool pots, about yay big, that many of them show disease. And it's very clear they're trying to depict disease, real people with these. So, and it's all online. So you can go like peruse these online if you like to, Museum Lorca. But anyways, in this particular piece, so this is, sorry, the Moche culture, which is in northwestern Peru. This is, again, somewhere between the 5th and 8th centuries or so is when they flourished. So this is pre-Incan, obviously pre-Columban, pretty impressive detailed sculpture, etc. And in this particular piece, sort of seen in two different views, there's some sort of ulceration of the nose. You can see the nasal cartilage been destroyed, as well as the upper lip, exposing the gums there. So this is what it can look like in real life. So this is an infection endemic to Peru, comes from sandflies. Anyone want to guess what this is? It's a little bit more like next level. Leishmaniasis, very good. So not something we see here much at all, but leishmaniasis, which has various different forms and can be, it's endemic in South America. It's also endemic sort of around the Middle East, et cetera, is, again, it's a parasite that's carried by mosquitoes and can cause pretty devastating things. Could also be syphilis. Remember, I mentioned that syphilis was like, it was in the New World. So this could be more advanced syphilis, certainly possible. Unlikely leprosy. Again, some of these paleopathologists think that leprosy is unlikely to have been in the New World. It was more of an Old World thing. There's more, I don't know if this is the same patient. They look pretty similar, just with different sort of head garbs on, or different patients, but I think more of the same. This to me looks like that mucocutaneous leishmaniasis. All right, and again, if you wanted any more like, feel for getting fired up about this, but like I published a few different pieces in some of this different stuff. On the Moche pieces, I published about helped publish with a nice group, but about like genetic disease in this pottery. So just a fun thing. Another reason that this is a fun topic, that many journals want something other than just like the hard science, and a fun little artistic piece is sometimes appreciated. All right, we're now back to Europe. Now in the 17th century, this is in the Duomo of Milan, beautiful cathedral. And so St. Charles Borromeo was a bishop and later cardinal, was very important for Milan. He's buried there in the Duomo. And so we have all these paintings around that kind of celebrate his life and after his life. Famously, during one of the terrible plagues that devastated Milan and northern Italy, he kind of like stuck around, helped take care of people, and actually survived. But so he was kind of always associated with taking care of the sick. So after he died, so there's kind of like a statue of him or a vision of him or something. He was like invoked as, again, this idea that Catholics can pray to a saint, and the saint asks God, and God will provide the healing. So this is going on in a couple of these pieces I want to show. So you've got this woman who seems to be asking for help, and the people who are there attending to her, clearly one thinks this is very malodorous. You can see the covering of the nose. Looks like probably just the one leg, so unilateral edema, and it's purplish, it's ulcerations. It looks like pretty gross, right? This is sort of necrotic. And in fact, I'm not going to read this whole thing, but basically there's a quotation about what's happening here, and it's like necrotic, like the tissue is truly dead, and even the nerve are dead. So we call that elephantiasis. Is basically what can happen is if the lymphatic tissue, which is kind of helps drain all the fluid in our body back up towards the heart. If that isn't working, things can kind of swollen out. You've probably heard or seen elephantiasis, one or two legs that are very big. All right. Anyway, so that's all the hints I'm going to give. So what's an infectious disease that could cause elephantiasis and then maybe get infected like with a bacteria or gangrene after? Any ideas? More common, like, again, more like Middle East, North Africa, but certainly could be seen in Italy, especially in those days. A little tricky. Filariasis, again, very rare, but around here, never see it. But basically, again, another parasite carried by a mosquito, infects his lymphatic system so that it's not working well. So basically, it gets all swollen up. And things that are swollen up tend not to do well against fighting infection. They get nicks, they get et cetera. And so they can gangrene or superinfection, which seems to happen here. They can also, chronic inflammation is also increases the risk of cancer. So that's called Stewart-Treves syndrome. If you have, again, this lymphedema, et cetera. So maybe that, I mean, the quotation talked about cancer, but who knows exactly how specific that is. So there's Stewart-Treves syndrome. So, and then if you keep on going on the Duomo, you'll see a similar piece. I'm not going to belabor it, but same idea, looking for healing, and it's painful and it's swollen, and it looks, it's called the miracle of the gangrenous leg. And again, what? But you can tell the foot is very swollen. So again, maybe there's filariasis that led to this swelling that predisposed to infection. Maybe something else, clots can lead to one leg being swollen, and that can have problems, et cetera. All right. 14th century now, so we went back a little bit, but I thought I would kind of continue this idea of legs. So Saints Cosmas and Damian, these are the patron saints of doctors, 4th century from Syria, and they were martyred, and they were known as the silverless ones, like they would treat the poor without being taken. So I thought there were a lot of parallels there to like pediatricians and primary care doctors today who are like silverless and sometimes feel like they're being martyred. But anyways, side point. They were famous for this, story legend of that they actually took, there was like a dead person, and they took the leg and then put it on and like transplanted it, and it like functioned. Obviously something very miraculous. And so you can see that leg there. And again, that's not just like non-specific, oh, I'm going to draw a leg that looks diseased. Like you really get a sense that the artist had seen a leg like this. Because again, it looks quite edematous. Look at the healthy leg on the gentleman on the bed. Like that looks pretty normal. So whatever it is, it's affecting just that leg. And again, you could think of the same differential diagnosis: filariasis, some sort of superinfection, DVT, et cetera. All right. Same doctors, same transplant operation. 15th century now. This is a Catalanese, so Spanish painter. This looks quite different though, right? You have these sort of circular lesions. It's a little edematous, a little swollen compared to the other one, but not much. So this looks quite different. Anyone hazard a guess what this could be? Now it's perfectly possible that this is just like venous ulcers or particularly arterial ulcers, although you don't usually have like multiple like that. So again, more common maybe in like the Middle East or South America. I'm going to hazard a guess. There's a couple MDs in the audience. All right, well, this to me, and I asked Ed Ryan, who's our tropical disease expert, who may be on the call right now, but this to me looked a little bit like cutaneous leishmaniasis. And in fact, so this top photo is one that I took from doing some medical mission work in Peru, but causes these chronic, pretty well circumscribed, sort of circular oval lesions. And again, like we can treat it, but they couldn't back then. More common in areas where they have the sandfly. So they call it the Aleppo boil from Syria. Again, Cosmas and Damien were from Syria, so maybe that's a stretch, or the Jericho boil. But again, this is a Spanish painter, so it's certainly conceivable that there could be sandflies in the 16th, 15th century and there. So I think that's interesting. All right, so here I'm covering all these like pretty rare diseases. And certainly, so I've done talks like this for medical students. I think this is kind of a cool way to teach, rather than just like, hey, memorize these slides, memorize these CDC charts, whatever. Okay, let's like give some historical context to it. So maybe that's another benefit of this exercise. All right. This is the Pinoteca di Bari. So Bari is a port town, port city in Italy. So Saint Roch is known as the patron saint of plague victims. And so oftentimes you see him with pointing to a bubo, which is basically an inflamed lymph node for bubonic plague. So he's sort of the patron saint of Black Death or bubonic plague. And you'll often see him kind of pointing to or showing, well, I've got this swollen lymph node in my thigh, kind of like I'm the patron saint of this disease. And sometimes it might be open. So here you see in this marble statue that there's kind of like pus draining out of this, infected lymph node. But this looks different. Maybe that's pus, but that's like the most weird looking pus I've ever seen. So What do you guys think? Looks like a worm, right? So I totally love this article that I happened upon. It looks like a worm. And so there's something called guinea worm disease, which again, we don't see much around here, but that's dracunculiasis. So dracuncula means little dragon. So basically it looks like this. Sorry, some of these are gross. So I should have said at the beginning, if you guys don't like gross stuff, like I could try to tell you trigger warning, but here's a worm. And so interestingly, these worms, when they get inside, so like it takes a long time for it to like grow, gets inside of you, slowly grows, and it's like an intense burning sensation, apparently. And the way you treat it is you get this little stick and you have to very, very slowly like wrap it around. If you go too fast, it breaks in half and then like it can grow again. But they have, again, these sort of circular lesion you can see that's coming out of, which again, doesn't look too dissimilar from what's going on in this guy's thigh. You think, okay, he's from body, i.e. this port town, so certainly possible somewhere more tropical coming back with something like this. More fun factoids, all hypotheses, but in the book of Exodus, you have the story of Moses and all the people are infected by these, or being tormented by these fiery serpents, fire and serpents. And then the way that they're cured is by Moses puts a bronze serpent up on a staff, wrapped around. I don't know. Is there some burning? Maybe there's something there. And similarly, the rod of Asclepius from Greek mythology is again a snake wrapped around a staff. So could there be something connected to how they figured out how to cure this terrible little worm? I don't know, but people have talked about that. Okay. All right. So far, so good, guys. Hopefully, you're having fun. All right. So this is the last category, bacteria. Rodin's the thinker. So this statue has made its way all the way around the world, right? And many different cities have it. So I thought, in all seriousness, I'm kidding. This is a joke. But he's been on that throne for a long time, so you don't know. So I thought maybe this is, Montezuma's revenge, which, is a real disease. So basically, typically E. coli, but the idea is the old world came and like knocked out a huge amount of the population of the new world with smallpox, et cetera. And in exchange, when non-natives visit South America, et cetera, Central America, Mexico, and have something with infected water, that they get E. coli. So that's why it's called Montezuma's revenge. Clearly, smallpox is much worse, but all right. This is an anonymous Italian artist, 1831. And it's a 23-year-old woman. And I don't know if there's any parents of little ones in the audience. I think this might be just a pre and post young kids with colic, because this is a before and after. Just like this is what you are before, and then you've had a kid with colic for a few months and you look like the right. But it's not that. So all jokes aside, this is a healthy woman, and then later, just 4 hours before, she died. So very quickly deteriorated. So she looks cyanotic, right? Bluish. And she looks, if you can kind of see all these sort of like new wrinkles and so forth, she looks kind of sunken in, like dehydrated, basically. Again, I don't expect you necessarily to like grab this because there's not major other signs, but any suggestions of bacteria that can cause hypovolemic shock and kill you pretty quickly? Cholera, right? So this is like from like a textbook describing what cholera can look like. Just terrible, death by diarrhea. So thank goodness for sanitation and clear water and all that sort of thing. All right, so here's another piece with cholera. I flipped it around so you can kind of see. Interestingly, so this is cholera to blame, but there's something called dry cholera, very, very rare. But typically cholera is just gallons and gallons of water diarrhea, and that's how you die. And you just need lots of IV fluids until your body can get rid of it. But something called dry cholera is if you have this complication where basically your gut isn't working, doesn't move, then you just kind of swell up with the fluid and then you die that way, which is also terrible. So anyways, this person apparently had dry cholera and again, looks sort of cyanotic and so forth from the circulatory shock because all the fluid's going like not in your bloodstream, but into your like gut, which won't help you. All right, this is just this touching painting. It actually was like used by the Royal Academy of Surgeons, et cetera, et cetera. There's no obvious diagnosis here. There's clearly a child who looks sick, but I'll just as a fun little aside or maybe poignant, but basically this is inspired by the artist's 1-year-old son who died of typhoid fever on Christmas. And I guess the artist was just really impressed by the physician's care and so forth. Again, they couldn't do a whole lot back in those days. Of course, typhoid is also vaccine preventable. this is just like a little aside. So I'm actually internal medicine pediatrics, although I mostly do medicine. But it's just go to like Mount Auburn Cemetery. These are from Mount Auburn Cemetery. It's so moving to me. I mean, I'm not going to be political, but I'll just say that vaccines are very good to prevent people from dying, especially little children. So just the number of graves you'll see at these older cemeteries of like, oh, here's our baby who died at 1 or at 3 months or at 3 years or whatever. So the under 5 mortality from things like typhoid fever, diphtheria, et cetera, was very high. So anyways, all right. We're now moving on to a different infectious disease, de la Santa Humilità. So you'll see in the upper left, if you know your iconography, but that looks like St. Francis. He's got sort of the Franciscan robe and the stigmata and the hands on the side. So St. Francis and some other attendants are helping these sick people. Some people posit maybe this is Black Death. I want to give it, it's not Black Death. Because you can see some of the noses of some of these patients, about 3 of them look like they're pretty ulcerated, like they've been kind of like gnawed off the cartilage there. And they're also carrying these little clappers, like wooden clappers, or maybe they're bells sometimes they'd carry to make noise. I'm going to hazard a guess what this is. Sorry? Leprosy, great, yeah. So, and he was, St. Francis, and the other clue is St. Francis is very famous for taking care of lepers, like actually kiss them, et cetera, to like make them feel loved. Also known as Hansen's disease is the modern term. So of course, this is from like ancient times, like Leviticus and the ancient Egyptian hieroglyphs, et cetera, make reference to leprosy, this sort of terrible, disfiguring chronic disease. And that really made them societal pariahs. So you didn't, obviously you didn't know exactly how it's spread, but if you stay away from them, you won't get it. More in the same vein. So this is in the British Library in London, but basically a gentleman who is begging. So some good, my gentle master, for God's sake. So he's asking for money and he's missing a hand and a foot. There's kind of been bandaged there, but the actual hand and foot are missing. And again, ringing a bell, like, I'm coming, like, don't get too close to me. Just a terrible way to live, huh? And again, there's more of these, but there's something called a saddle nose deformity, where again, it destroys some of the cartilage here. So it kind of looks more like a saddle, or like leonine facies, again, from chronic leprosy, AKA Hansen's disease. Again, a little less, just continue. And then this actually made, so my last case of leprosy, the sort of title of Clinical Infectious Disease Journal, but you can see that clearly this isn't just stylized. This is somebody who's seen people that with leprosy, and this is what they look like with the natal cartilage destroyed, et cetera. And this is a picture I took actually in India. Like, people still have leprosy. Fortunately, it's pretty rare, but it still happens. You can see again some of the things that we were just talking about. Again, before Goya went a little too crazy, so one of his earlier pieces, this is Lázaro de Tormes, and it's also known as El Garrachillo, which means like this strangler, which is probably a play on words because it's almost looks like he's strangling this guy, but it's also referring to the disease process that he's actually trying to help this kid. So this is, if you look inside, this is probably what's inside there. Anyone hazard a guess what that is? Diphtheria, very good. So diphtheria is, back when we didn't vaccinate against it, we'd see it in pediatrics, and basically it causes pseudomembrane kind of like closing off the back of the throat, making it hard for a child to breathe. My dad talks about how there's a kid with my dad is a pediatrician, like just like as a resident, like just barely intubating the last second, a child with diphtheria with like, this tiny little airway. If you don't get it, like the child's dead. So scary stuff. And in fact, 5 of 6 Goya's children died in childhood. So we're very grateful for that D and DTaP, that we don't have to see that much anymore. Okay. Cloisters Museum in New York City is just so great. But if you walk through, you'll see this. Oh, look at that. Want to hazard a guess what this is or who this is? And so what is the disease? Yeah, perfect. So we talked about it a little bit earlier, but this is a bubo, which is influenza, bubonic plague. St. Roch is the patron saint of plague victims. So, classically would maybe be more in the groin and inguinal lymph node, but that's a little risque. So they'll kind of show the upper thigh, which, certainly can appear there as well. So again, you can find, like, I just give another example of the same, but this is Tintoretto, St. Roch in the hospital, again, caring for plague victims. And you can see all these lymph nodes, some probably more anatomically correct for where there's lymph nodes than others, but you get the idea. Okay, this is kind of a cool historical piece because this is possibly the first time that this disease was like ever documented was in this piece, and it ran along with like an article or like a poem about it. So this is Dürer, this famous engraver. It's called Man with a Pox, 1496. Again, cover of Clinical Infectious Disease. I want to guess what this is. Syphilis. Now, how do you know that, Dr. Fembez?
On the hand.
Hand.
Secondary syphilis.
Perfect. So there's not a lot of rashes that actually appear on your palms and the soles of your feet. Secondary syphilis is one of them. And again, this is shortly after 1492, Columbus sailed the ocean blue, and therefore syphilis came back and sort of spread like wildfire. So this new disease popped up and it sort of captured the imagination of many people. So it's brought from the New World and then spread by wars are going on at the time and soldiers doing things that they shouldn't, I'm sure. And so it's very, however you want to like stigmatize who brought it to you, you call it the Spanish disease or the French disease, the Italian disease. Go ahead.
The Battle of Naples, they say it kills more people than the actual battle of Naples.
There you go.
Against the French, I guess the Nepalese.
Yeah. If for anyone in Zoom land, basically one of our attending physicians here is talking about how in the Battle of Naples that syphilis probably killed more people than the guns and swords did. More of the same. So mortem galorum, the Gauls, the French. So again, as the entire body is affected, you see people who are like barely clothed, so there's like reference, maybe there's something risque going on or an STD, et cetera, but there's syphilis. And in the old days, what did you do? How did you test for stuff? Looked at the urine and you tasted the urine. Gross. But that's what the guy's doing. That's when it's good having a nephrologist around. I call a consult for that one. I'm not so good at that, but I know someone who is. All right. Going back to Mochi pottery, this is, again, roughly 8th century-ish. A little, again, like, sorry, this is like not rated G, but this sort of erotic pottery, rather. So you see these raised genital lesions around the genitals, buttocks, somewhere on the torso or the arms. Who knows? But maybe this is secondary syphilis. Again, syphilis was in the old world, so it could totally be. HPV, like maybe. Doesn't usually go up on your torso though, so that'd be kind of weird. And there's something called verruga peruana. I've never seen this, but apparently it can cause these large sort of circular spherical kind of blood-filled lesions. So like maybe, although yeah, I don't know, but somebody published on that. Okay, I'm going to do a couple more syphilis cases just again because this was such a thing. There are certain diseases that were just such a part of life that we don't have to worry about much anymore, but thank goodness, penicillin. But this is Marriage à la mode. So there's basically 7 pieces that this French artist did basically as a satire. And like syphilis is all over them, basically. So for example, here's a gentleman showing this doctor who's on the left wearing kind of the greenish coat. He's like, basically, these pills aren't working for me. And this is mercury pills. So yeah, they probably aren't working for you, but that's what they tried back then. And then everybody's got signs of syphilis. So they just do this sort of stylized black spots as if that's syphilis. But more specifically, again, you see the saddle nose deformity in the doctor in the bottom left, where again, it's kind of the chronic syphilis, tertiary syphilis has destroyed his nose. And then you've got this girl who's kind of wiping a sore on her lips, which may be an earlier stage of syphilis. And then if you continue again, there's more of these paintings, but just to show a case of congenital syphilis. So you've got frontal bossing. So the forehead looks a little bellowed out. Again, that saddle nose where it looks kind of like concave, and then the kind of bow-legged. So that's classic for congenital syphilis. One more example of syphilis for funsies. This is Munch. It's called inheritance. And it's also called, I think just called, what's it called? The syphilitic child. So again, you see things that match up pretty well with what we know that congenital syphilis looks like. This is why every pregnant woman is checked for syphilis in their blood testing prenatally, so that we don't see this much anymore, thank goodness, because it's terrible. So you can kind of see this woman just like weeping over her devastated child. All right. This one's pretty interesting. I'll buy it. It's a bit of a stretch, but I'll buy it. So this is Jan Steen, doctor with his patient. So you've got a doctor, and this patient's like not lying down, which is the typical thing for a sick patient, but kind of sitting up. And she does look like she's got this glistening gloss, and maybe she's been sweating and febrile. He's checking her pulse, so maybe her heart rate's a little fast. Looks like her hand is a little swollen. No, I'll buy that. It looks a little swollen and red, so that's arthritis. And then again, orthopnea is when you feel short of breath when you lie flat. Ortho means straight or flat, like, or orthopedics. So she doesn't want to do that. She wants to sit up so she can feel short of breath. Anyone hazard a guess what this could be? Put all those together in an infectious disease mindset or post-infectious disease mindset. Yeah, so close to it. So rheumatic fever. So something that's reactive to a infection that we had. So basically, nowadays we probably give too much antibiotics, bless you, for strep throat, but there's a small risk of getting something like this if strep is untreated, less so in the serotypes that we see here in the United States, but more common in other places. So maybe she had rheumatic fever, which basically is this post-immune complication of strep that can cause all the above: heart failure, arthritis, etc. Like from the heart valves is a heart failure. All right. I wanted to throw at least one Egyptian piece. So this is one I could find with it. I think likely infectious disease. So here's a gentleman who's got quite a bent spine there. You can kind of see it's going like this. Anyone know what this is? Or this could be? Yeah. So this is a patient that I saw in Ethiopia. So this definitely still happens in the world. And it's basically a disease that it's like malaria. It's like been with us forever, and it's terrible, and it kills so many people. Although, unlike malaria, like a lot of people just kind of have it dormant because it just kind of hides in our white blood cells and our macrophages. But if you Google what's killed more people than any disease in all of human history, TB is what Google will tell you is number one. Certainly, it's what more people infected with anywhere time in the world. Right now, a fourth of the world is infected with TB. Like here in 2026. Now, they're almost all latent, which is mean like it's there, it's not causing problems. But anyways, so tuberculosis of the spine is also known as Pott's disease. And again, a fourth of the world is infected right now. Obviously, a much higher percent back in the day, and even higher during the industrial times when now you have really crowded conditions in these tenements, and everyone's in factories coughing on each other, et cetera. So Pott's disease, pretty interesting. This is Rembrandt's Bathsheba. Again, sorry, it's not rated G here, but here we go. So this is a lot of people have studied and thought what could be going on, because this breast looks like a little asymmetrical, a little kind of like there's a bulge there and there's a bulge there. It doesn't look like a sort of like the other breast looks more sort of symmetrical. And so what could be going on? You can see several people published on this. Some people thought that this could be breast cancer. In fact, they used it in advertising in Australia for breast cancer. But that doesn't work because she lived 9 years after this painting. So if you had peau d'orange, which means like orange skin, which is like inflamed, advanced, bad breast cancer, making the skin look like a orange skin, you're not going to live for 9 years. So she in those days. So probably not bad. But it's nice to have an ad campaign for cancer screening. That's great. Get your mammograms. More likely, I think, is tuberculosis. I'm going to the TB theme for a few slides here. But basically, TB is something you would have chronically that would cause swelling, wouldn't kill you in the moment. And whereas, for example, if this was more just like a mastitis, that's more acute, and therefore you'd probably have more, you wouldn't be wanting to sit there getting your painting painted. So I'm looking at the clock here. I'm just going to kind of zip through the rest of these slides so I have time for questions at the end. Here's another breast, looks like asymmetrical. Maybe this is chronic mastitis. This is more TB complications, possibly. Maybe this is scrofula. That's a TB of the neck area. But it could just be that this guy has a scar from the sword duel. But anyways, scrofula is also known as the king's evil. There was the idea that the king could touch and it'd be healed. More paintings about TB, just emphasizing how terrible it is. But basically, this pulmonary TB killed lots of people. Killed this painter a few years later. Munch, his sister died of it. He survived it and was sort of forever haunted, and he painted several paintings about this. But interesting about TB, there's also this idea of like, during the Victorian times, the romantic age of it being more like attractive. So it's called consumption, right? And so it kind of consumes you. So you look sort of thin and you have a pallor and they're sort of more delicate and weak. And there's something like this is the era of corsets and everyone's like looks very white, but like very pink cheeks and stuff. So maybe pink because you're having fevers every day. But it's very interesting that there was kind of this like yin and yang about TB in that particular era. And some artists had actually made them feel more creative with the sort of TB fevers. But anyway, so you get an idea of like people painting TB almost like as a pretty thing. This brings me, I think, to my final slide. Yeah. Oh, so we understand how different times disease is reviewed in different ways. That's what art helps with. So this is Christina's World, a pretty famous piece by Andrew Wyeth, and who lived here in New England. And we know about this woman that basically she had this from childhood, this sort of severe progressive neurological disease. You can see that she has some joint, see her, she almost has like sort of like claw hands there. And she actually later in life just crawled around. She didn't want to use a wheelchair. This is how she wanted to move around. And actually she went to what was then called Boston City Hospital. So now BMC. She went there for a week. They couldn't figure out what she had. They said, I guess you keep on living as you've been living. And so she did. Then Andrew Wyeth saw her like crawling around in the grass outside of his home. I think it was in Maine. And he asked her permission and painted her here. So people posit different things. Charcot-Marie Tooth is a neurological disorder. Although usually you see that more in like the feet, maybe polio. One person threw out chronic Lyme, which I don't know. Chronic Lyme usually, like arthritis, usually affects like the big joints, like the knees, not like the hands. So I don't know, it seems a bit of a stretch. So we've appreciated in this exercise the limitations of trying to diagnose posthumously and from hundreds of years away. But hopefully we have a greater appreciation of this exercise and of the people have come before us and helped medicine and modern society to be free of many of these terrible diseases. So that's my talk. And just another reminder, like there's much more where this came from. So if there's something you want to like, oh, come talk to our oncology group about whatever, like let's talk about that. That'd be fun. That's it. And I'll take any questions in the last few minutes we got.
I'll start with two things about Sick Bacchus from online. One was somebody noted that the painting's on loan to the MFA right now.
Oh, wow. Look at that.
And then there was a question, do we know if the veneer was ever cleaned, since the veneer can sort of cause sort of yellowing over time, and which might sort of change your perception of what the disease might have been?
That's a great question. So if anyone didn't catch it, the question is, a lot of these paintings, restoration techniques over time have obviously got much better, but sometimes they're just like the way they would kind of try to preserve pieces. It would be this kind of relatively like yellowish, darkish veneer. So could that be the reason this looks more jaundiced? I don't know specifically about that. Again, I'll just say I've seen this piece in person, and I think I've seen the other piece in person, and one looks a lot pinker than the other. So I don't know if there was different restoration techniques or not. But yeah, it's admittedly I'm not too sure. It'd be interesting to ask a art historian or someone familiar with the restoration of that piece.
Any questions in the room?
Some final points. Have you seen any examples of schistosomiasis? Thinking that's a waterborne disease with host parasite mediators?
Yeah, the question is about schistosomiasis. There was one painting I almost included. You can tell I had to like take stuff out. Well, I mean, so schisto, if I'm recalling correctly, so it can get infected to the liver and can then go through your GI tract and can cause terrible hemorrhagic vomiting. You die from that, if I'm recalling correctly. There was a painting of somebody vomiting blood. I think it was in that setting of the Seven in Milan in the Duomo, but it seems so non-specific. I couldn't tell that was schisto or something else. But to answer your question, no, I haven't found any schisto paintings. But
no, yes, no.
No, I haven't. No, definitively no. Yeah.
Someone asks, is there a collection of medical art to visit in New England? Has anyone put together that tour?
No, although I've done a couple times a tour by me in the MFA. Let's go see the paintings that have disease. But no, I'm not aware of any. I mean, you got here at the Russell History Museum. You guys have some nice artwork downstairs, but I'm not aware of anyone that specifically like clusters it. You'd have to kind of go searching for it, which is fun. So go to your local museum and look for it.
Someone asks, are there any artistic depictions of pertussis?
Whooping cough. Again, I think that'd be hard to find. You find somebody who looks like they're coughing and turning blue at the face, but I'm not aware of that.
Other questions in the room? Okay. All right. Well, with that, Thank you again, Dr. Heyne. This is fantastic.
Thanks, guys.